All right, my name is Edgar Villa. I'm the clinical supervisor at Crossroads Recovery Center. Today we'll be doing a family session, giving education what to expect. You went through graduation today, which is very beautiful and very difficult sometimes because the success rate for recovery is very minimal, very short.
I'm turning it so I can't.
All right, so what we're going to be doing is talk to you about what stages people in recovery go to, what to expect after the 45th day, after the 60-day, 120, 180 days. What puts people into, how can I put it, risk factors for them to go right back and relapse. And what do we start seeing after the 180th day? And we're going to start educating yourself a little bit more. As you already know, I'm going to add to this component of what happens to the brain part of it. And today is about giving you that roadmap to recovery. I'll be going back and forth writing things. Everything that you have that you need is right in front of you. So if you want to write, there's pens. If you want to ask questions, this is the time to do it as we talk about it. Now, as you know, be aware of is this roadmap for recovery is interesting. We're going to go back and forth. Everyone that's been in treatment with this has gone through the withdrawal process. The brain has released or has been taken away what they actually is addicted to. And then you're going to see your loved one go into this honeymoon period. I don't know about you guys know this, but during the withdrawal period, typically our clients, someone in recovery, calls, I want to come home. It's so horrible here, the food is not good. They just tell you about everything that's so horrible in the program. That's the withdrawal stage. Now you start seeing our clients' honeymoon period, early absence, is between the 15th day to the 45th day. 45th day we're like, I could do this, I don't need more recovery, I got everything handled, and something's going on with the brain. Think of the withdrawal, your brain levels like this, with dopamine, serotonin, and GABA, and other neurochemicals, is when you're withdrawing, this is the normal base level of anyone, then it drops significantly. And their body wants it. And then what happens honeymoon period is, all of a sudden their brain says, we need to make more of this drug naturally, so it boosts it up. And that's on the 30th, 45th day, 20th day, they say, I don't need more recovery, I'm ready to come home. And the person looks like he's ready or she's ready to come home, but in reality that's not what's going on. Then they hit what we call the wall. And the wall is all of a sudden your brain, because the brain's been affected, goes like this, back and forth. We see mood swings, irritability, and then the adjustment stage is when we start seeing some of these problems, but we start seeing the real true problem. When we start seeing if there's any other mental health problems. We start really seeing if there's some depression, some anxiety at this point in the recovery process. And because they're learning to adjust themselves, but they're still having difficulty because maybe sometimes this is not being recognized or not being treated. And one thing I want to let you know is, great, some individuals here have 45 days, 60 days, but there's still stages they have to go through this process. And give you that information is really important for us. Here I have, if you look on your paper, is the withdrawal period is within, depending on the drug that you're using. If you're using methamphetamine, it's going to be a little bit longer than day 15 because methamphetamine really does a huge dopamine rush. So think about your best day ever. Best day ever. We call it units of dopamine. You win the lottery, maybe $1,000, $15,000, whatever it might be. You're super happy, graduation, whatever it might have been. That's 100 units of dopamine. Now think smoking cigarettes, like 200. Smoking marijuana, 250. Doing heroin, 750. And then you have methamphetamine, 1,100 units of dopamine. So that's what's going on with the brain, is you're giving it all this natural dopamine rush that the brain's gonna want it. And then that's why with methamphetamine, it lasts a little bit longer. So think of methamphetamine maybe 20 days out. And that's what we call it protracted, because we have symptoms left over after this. And then get to the honeymoon period, it takes them a little bit longer to get to the honeymoon period, and it doesn't last as long for them because of that depletion. And with marijuana, kind of the same thing because it's released slowly in the body. And this is when we start seeing with components of stimulant addiction syndrome, we have seen behavior disruption. Because you notice the brain controls everything we do, what we think, will behave. So if you already have a condition like bipolar disorder, if you have another condition like depression and whatnot, that is affected by serotonin, there's a lot of now studies out there where actually say they look at brain scans with people that have schizophrenia and people that use meth, and they can't tell the difference of the brain scan. Because of the way the dopamine affects and the serotonin level also affects, so it's really difficult. So you're going to have behavior disruption, emotional disruption. The brain controls the way you feel. And the middle part of the brain is called the midbrain. It controls sadness, anger. So when that gets affected, you're able to control your emotions. It can be very difficult. Cognitive disruptions, that means you can't think clearly. All of a sudden, you can't make the connection between what I did wrong and my drug usage. And people say, well, why can't you see the results of this? Can't you see what you're doing with the drug? I don't see it. It has nothing to do with that. It has to do because of this, because of X, Y. They don't take responsibility. It's not because they can't. I'm not saying they're not responsible. What I'm saying, at that level, the brain does not make the connection. They just are not logical in sense. If anything, I'll give you an example. It was one case where I found a person that had meth on them, and I had to take it away from them. The person cried for their meth. It was like it becomes such a survival mechanism. That's what the brain wants and the brain needs when it comes to some of these drugs. And also there's some family relationship disruption that goes along with stimulant addiction syndrome. And usually the withdrawal stage, 15 days. Any questions on the withdrawal stage? Anything you guys want to know about this withdrawal process? Any questions?
That's the process that the brain goes through, correct? The 15 days is the process, the time that it takes the brain to go through what they're going through. Is that correct?
The 15 days is for the body to eliminate the drug out of the system. Okay. At the psychological level, they're still withdrawing.
Okay.
Yes.
Is it different with heroin and crystal meth, the withdrawal amount of time?
Yes, it is. Typically, what we see with withdrawal with heroin, more of a physiological withdrawal versus a psychological withdrawal with meth. We typically see 20 days out with meth because there's still some residual paranoia left over, a little bit left over of this very high distrust, a lot of depression that comes along with it. Usually with heroin is usually a good 15 days, but physically, and they start feeling good right away because the pain is what causes them more. It's not so much a depression, but the physical pain is gone, so they feel more elevated. So you start seeing that different aspect of it. Yeah, you're welcome. Good question. And with the withdrawal stage, we're looking at 4 primary stages or areas is the behavior part of it. And behavior inconsistency means that they say one thing, they do another. They kind of have erratic behavior. It doesn't really make sense to us. It's a lot of this drug-seeking behavior, a lot of the lying. And that's where you have to look at. There's a lot of confusion and the ability to concentrate. They start one project, they can't finish it. I tell a lot of the therapists and counselors, I go, we really can't do counseling with someone in withdrawal. Sometimes you with the family member, you're trying to talk to them and make sense. Oh, we believe in you, we'll do this for you. That's not gonna sink in. When someone's going through the withdrawal stage, no matter how much emotional connection, how much you love them, that's not gonna break through. We just need to stabilize them. That is the goal, stabilize the brain. We have stabilization sessions with the clients, and we tell them the same thing 3-4 times throughout the day, and they forget it. Why am I here? Because you're detoxing. Well, I'm better now. And then they come back again. Why am I going through this again? And it's a constant cycle of education over and over, and dealing with a lot of the depression, a lot of the anxiety, a lot of self-doubt. And the self-doubt has to do with, I don't think I could stay sober. I want this, but I don't think I could do it. It's like the drug calls that because the brain wants that. And then the mutual hostility and fear when it comes to families. A lot of anger, a lot of hostility towards the family members because you're taking away that drug. Bye-bye.
See you later.
The last thing we're going is the withdrawal stage features are physiological detoxification. There's a lot of cravings. That's one of the symptoms. When there's a lot of stress, also there's craving. Craving is a natural thing. People say, well, just because I crave doesn't mean I want the drug. No. Think about this. Think about when it's just another symptom. You have a heart problem, right? When you have a heart problem, certain symptoms happen because of that. Certain things go numb. Same thing with drugs. Whenever you're having a craving, does not mean the person wants drugs. I want you to think about a lemon. A nice lemon. Cut it. Think about it. What happens to your mouth?
Gets to water.
Did you tell yourself, I want a lemon? No. The body natural response, same thing happens with the craving. And because the brain controls this, that's what's going to happen. It's not like we wake up and say, oh, I want a craving right now. I want to have a craving. I wish I have a craving. That's what happens. And there's different triggers at the withdrawal stage. It's more, the reason they're having cravings is because the brain wants dopamine, what's serotonin, what it wants. Another feature is depression. There's a lot of low energy, irritability, exhaustion, insomnia, distorted thinking, memory problems. When people are going to a withdrawal stage, they're not the easiest to be with. It's very difficult with them because they're going through a lot of emotional and a lot of physical problems at the stage. And the reason I'm showing you this is you have loved ones that have been with us, they've gone through this stage. It's not an easy stage. A lot of people leave detox. A lot of people leave detox. It's a really hard stage because we can't keep them, we can't force them. So there's a lot of strong will just to stay there. So when someone goes through detox, people cry, people want to leave. This is a very hard stage. People that are using meth, they isolate. They don't want to be around anyone. It's a huge depression. Everything is black. I had a client tell me, you know what, Edgar, I want to do this, but I just don't think I can. I really want this. It's really calling me. He would cry. And that's what thing you have to look at is when your loved ones go through this, it's very hard, very difficult. And this is what makes people relapse in this stage, is unstructured time, having too much time under the hand. That's what sometimes is good, to take them out of their home and somewhere else different, because the proximity of the trigger is really important. It's really hard for clients that live in the Whittier area for us, that live in this area, to stay sober because they know where the connect is at. It could easily drop up. So sometimes it's really important to move them out from a different county, move them out from a different place, so that way they have a better ability to say no, or at least stay away from it. That's why we take away the phones. That's why we try to monitor everything. Because that's a very difficult part of this process. The alcohol, marijuana use, this is the interesting part is people might use meth, heroin, and they might start smoking marijuana. Because, well, that's not my drug of choice. I've never had a problem with alcohol, so I could drink a little bit of alcohol. But what happens is once you drink alcohol, that triggers the reward path of the brain to get activated. Now I want my meth. You might not be close to it, but that's what it is. People say, well, drink it, lets your guard down. No, at a biological level, what happens is your reward pathway in your brain, the mid part of the brain gets activated. And then your brain wants a little bit more of it. It wants dopamine. The brain is trying to adjust itself at this stage. And it's trying to do whatever it can. That's why we have power cravings, you have paranoia, depression, distorted thinking. And all these things put people into relapse. Because if someone's paranoid, they're not going to stay, they're going to want to leave. They're looking at windows, someone's really sad, they want to go do something that makes them feel better. And this is interesting. I give this education to people, disordered sleep patterns. I'm not sleeping well on this medication. I'm like, well, what do you expect? You're detoxing. You're going to be sleeping 1 hour here, 3 hours here, and they're not going to sleep in at all for maybe a day. Because your brain's trying to adjust itself. And sometimes it's really unrealistic, and some people oversleep with this and during this stage. So everyone has gone through this stage, which is really wonderful, and then move into the honey stage. This is my first stage. I really enjoy clients at this stage because they're really motivated, they're energized, they're cleaning up, they're helping out, they're participating. But then after the 20th, 30th day, they're like, I know everything. I'm ready to go. I'm ready to go to IOP. Why you guys have me here? You know what I mean? And then they start getting a bit overconfident and angry because we're keeping them too long. The material's the same. It's because they feel so good. Some of you smiling because you can relate to that, huh? Yeah. And this is the primary manifestation is behavior. They have a lot of energy. But the thing is, they have a lot of energy and they're unfocused. They start a lot of projects to do many things, but they don't accomplish them. And because they have the ability to prioritize, they want to get everything done. What they're doing here is they make a list of all the things they haven't done, all the things they need to do, and they try to get everything started. And because they're overconfident emotionally, and because they think they're cured, because now I don't have cravings, I'm feeling good, and because all of a sudden now happens, well, maybe it wasn't that bad. You know, I'm feeling better. Maybe then the family starts thinking, maybe all they needed is just a little bit of time. Maybe it's not that bad. No, it is this bad. This is the honeymoon stage. This is where the car feels so good and happy. And this is you physically see them differently. You know, you're like, wow, you got a kick on your step. You're feeling so good. Wow, you're really helping. And they talk very nicely. They're smiling more. It's like, yeah. And you know, and this is when I want to go home. I'm ready to go home. And it's really tempting to bring them home. Very, very tempting. And this is some of the features. Is the overconfidence is a big problem. And when I don't mean confidence, I mean overconfidence. So now what they're doing is, instead of actually, because there's a difference between being overconfident and being smart. Overconfident means, I'm cured, I'm gonna put myself in situations where people sell or use. And they have difficulty concentrating during this stage because they feel really good and doing a lot of projects. However, one thing they don't realize, they have continued memory problems in this area. They start projects, they don't really finish them, intense feelings, mood swings happen, and they have an ability to prioritize things. Can any of you are in this rate? You say you are. How are you? Do you recognize you're in here? Or have you been through this before?
No, the honeymoon stage, do I recognize any of these symptoms? Absolutely. Inability to concentrate, finish things, is definitely there. Memory loss, have a hard time remembering things, is definitely mine. And surprisingly, mood swings, because I'm generally not a moody person, but seen that. Not overconfidence, because I'm still scared of it all.
And the thing is,
real leery.
the thing is being respectful of the disease, because it is a brain-based disease. I've discovered that it affects the brain. It changes the brain chemistry. It is a brain-based disease, and I'm glad you recognize the importance of respecting the disease.
Yeah.
And the things at this stage is the brain is still trying to balance itself out, and that's what you're going to see a lot of. And that's what a lot of people make these mistakes in the honeymoon period. And this what makes people relapse in this is the overconfidence. You notice overconfidence is the big one. The big thing that I see here, and when the honeymoon stage, is they start drinking again, or they start smoking a little bit of weed. This is where I start seeing them stopping their medication in this stage here. When they think, the doctor was crazy, she only talked to me for 10 minutes and she diagnosed me with this, and I don't have that because I feel really good, and then the medication stops, and all of a sudden their relapse happens again. And another thing that happens is continue the structure. They stop going to meetings. They stop having an agenda for themselves. They stop meeting their obligations, and they don't want to continue to change. They think they've mastered. They're okay. They're fine. And then the addictive lifestyle happens. They stay up all night, sleep in. That you see a lot of these addictive lifestyles happening. And because they're not prioritizing and they're still having some suspiciousness, some paranoia, it makes it really hard for them to open up, or to make aware that this was going on with me. And this was happening during the honeymoon stage. And some of you are in the honeymoon stage, and then this is the easiest part in recovery. The hardest part is the wall. Some of you are in this area, the 45-day to 120 area. And then this primarily is the hardest, because now your brain wise is down here and is doing this, and you feel sluggish, you don't have much energy, don't follow through on things. Really help to difficult motivating ourselves, especially with methamphetamine on this one. This is a big one, and this is when you start having thoughts about using and you justify it, because people start thinking, well, I've been sober for 120 days, I've been sober 90 days. Why do I still feel this way? I should be feeling better. I'm working, I'm with my family, I'm with my kids. Why do I still feel really bad? Because your brain's not healed. Think about this, you're only 120 days out. You're only 4 months in, 5 months in. That's nothing for your brain to heal itself. It's gonna take 2 years for the brain to fully, and we actively have to do things. We have to eat, exercise, aerobic exercise to increase blood flow, avocados, blueberries, things that make the brain feel better. I mean, that's what I started seeing is in this area, it's really important to exercise, to work out when you're in the 120th day, the 90th day, 180th day, because what happens when you exercise, you get increasing blood flow. So that's what you really want to start doing. You start exercising, working out. That's really important, the foods that you eat also in this area, because you're going to have to fight depression. And even if you're not depressed, if you're ever a depressed person or you have the diagnosis, you're going to be more depressed. And a lot of people are thinking, well, my medication's not working anymore. I need to stop my medication. Something is different. No, this is natural. Your medication is working, but because your brain is going like this, there's only so much your brain could do for you with the medication anyways. And a lot of people stop taking their medication during this time because they think it's not working for them. Really irritability, there's a lot of blaming going on. They're like, you know, you don't care, you don't believe in me, and this is where we start accusing our family member, are you using again? You know,
How long does that last?
this one lasts between the 45th day to the 160th day. For you that use meth, you're probably looking at maybe 180.
After 180 days?
Yes.
180 days.
Mm-hmm. Yeah. So you're from 45 days to 180.
I think I'm at 52.
Mm-hmm. So you're.
Something like that?
Mm-hmm. If you notice during your process, the last week or so have been more difficult with depression.
For me?
Mm-hmm.
Yes.
Yeah. It's because you're hitting this part of the wall.
Yes, and I'm getting more tired again.
Yes, you're the sluggish, low energy. And you might think, why am I feeling this way? It's because you're in the wall part of the brain. That's what you're doing. So this is normal. This is gonna go away. You're not gonna be like this forever. You know what I mean? So it's something you're gonna pass, which is a great thing.
180 days.
Yeah, 100 days.
Extra exercise.
You do exercise, you're working out, it's gonna pass.
I'm writing 180 days. Okay.
So I have a question.
Sure.
For people who were suffering with, say, depression prior to having the addiction, is this different in any way, recognizing the depression and this inertia and this wall? Is it going to be any different?
That's gonna be any different. It's just gonna be depression straight up. It's gonna be more intensified and harder. It's gonna be more intense.
More intense than what?
Then so say you already have depression, how that feels.
Yes.
This is gonna be a little bit, the thing about this, it's not gonna be depression straight every single day. It's gonna go up and down.
Okay.
It's gonna go up and down.
See, if I know to expect it, I can handle it.
Put it this way.
Does that make sense?
Yeah, you're gonna be doing 2 great days, all of a sudden you're gonna go down and be depressed, and then what's going on with me? You know, and then you're gonna go up again. And during those times of down is when the craving might happen. I want to go use to make myself feel better. It might be two days that you're feeling depressed. Same thing happens with alcohol, because alcohol depletes the GABA receptors in the brain. Same thing happens with this stage.
As long as I know, education is key. As long as I'm aware, then I won't, if I have 2 days down, I won't start to panic, because I panic when I get locked in.
Yeah. Yeah. Any questions on the wall stage? Any concerns you have for family members that are going through this process? No? And I really like to do this particular education is because sometimes you get your son, your daughter to treatment, and then you see them, the process, the pain, and then you see them feeling really better, and then they come home and they get worse. And what happened? Nothing really happened. What happened is you're just meeting them at the wall. That's what you're being introduced at. And this passes. That's the great thing, this passes, but they have to remain structured. They have to do activities. They have to go to meetings. Structure is the big key to this. Having structure. Going somewhere. Even when you don't want to, you kind of have to because of the emotional swings, the unclear thinking. They have to go to meetings so that they could start fighting these unclear thinking when they start doing the relapse justification, so they could vent to the group and the group could give them another way of thinking. It's really important. Any questions? And this is what puts them into relapse factor, or why people relapse during this stage, is increased emotions. They feel more depression, more anxiety. They start having more conflict with the family members, with themselves, with the other individuals. And this is what they start saying, man, what the hell, I'm gonna go use anyways. Things are not working out, I'm not feeling better. And then that leads to loss of motivation. They can't enjoy things. Think of this, it's like having a great film. And you go to the movie, and it's a black and white film, but it's really a colored film. That's how individuals in recovery are viewing this. That's how they view their life at the moment. They don't see the blue shirt. They don't see the nice designs on your shirt. It's just blah. They can't enjoy it. And our family try to snap out of it. You know, everything's okay, you're doing so well, why do you feel like this? It's with the brain. That's what the brain is doing to itself. Because the brain controls all this. And then because you're not feeling better, we stop our structure. We stop going to the meetings. We start talking about the way we feel. We isolate. We just don't talk anymore as much. We don't come home at a certain time. This is where people start going to the Connect's house, the old neighborhood, see what's going on. And what happens in this area is when people feeling really low, then they start doing high-risk behaviors. If you have a history of stealing, a little bit more stealing. If you have a history of racing, that's going to happen. Also, when we get angry, we get a little bit dopamine rush. So this is where we start doing a lot of these behaviors. Because the brain wants to feel better, but we struggle. I don't want to use, but I want to feel better. So what can I do to feel better and not relapse?
Everything isn't always better in black and white, right?
No, not at all. And it's going to change. This is the thing about the wall. The wall is such a confusing part of this component where you're going to have 4 or 5 great days, and all of a sudden, what happened? And then 2 or 3 bad days, and then a good day. And sometimes you go back and forth on this period. Yeah. And this is where they don't want to go exercise because they're feeling tired. This is where you need to push them to go exercise. Aerobic exercise is really great. And then they have some paranoia left over. Skip this, we can move on to the next one. And then the adjustment stage. This is a stage where they're being a little bit sloppy regarding limits. This is where they kind of start trying to figure out where they fit in. This is when we really start seeing the secondary diagnosis of some form of mental health problem. This is where we start really seeing appearing, because now by this time, if they're sober, it's no longer the drug itself. Now it's a mental health problem going on here. This is where we start really seeing if it's bipolar disorder. This is where we start seeing if it's really clinical depression, if it's some type of general anxiety disorder, or some of that, or schizophrenia. This is what happens. I actually had a parent call me, because most of my clients are all my clients, most of them are dual diagnosed. Most of them are. And I had a mom call me not too long ago, and she said, Edgar, what's wrong with my son? He's wearing dark sunglasses. He's getting moody, he's getting standoffish. He's still going to work and doing all the obligations. He's like, can you test them for me? And I'm like, I give you tests. Can you test them too? And he's like, no, I don't want to cause a problem. So you do it. I'm like, okay, I'll do it. That's fine. I tested him. He's clean. And I quote, he's clean. He's like, are you sure you're telling me the truth? I'm like, he's clean. And she was surprised, why he's acting this way? Because he's going through the stage where the depression's hitting him worse. And that's where he was at. And he wasn't relapsing at all. Not at all. And then it's interesting, I need to see you twice. So I'll see you again on Thursday. On Thursday, he was good. He said, I was just going through this phase. And I had to educate the mom, like, this is where it's going on with it. And it's really important, because sometimes we could overreact as a parent, as a loved one, and then attack. And sometimes it's warranted. And sometimes it's not. Sometimes it's out of our loved one's control, their emotional state, because of what's going on with the brain. So this is what to expect, features with your loved ones. You're going to have relationship problems. They're going to come back again. They're going to be a little bit defiant. You're going to try to push them to, get their goals. They're going to be really bored. They're like, well, go get a job. Oh, I don't want to hire me. I feel so bad, and the guilt and shame sets in. And then if they're working, this work sucks, I don't like this, they're just complaining about things. And the underlying psychopathology may surface a little bit more now. You start seeing a little bit more of the real problem what's going on. And sometimes, when they first get diagnosed during the withdrawal or initial stages, our diagnosis might be incorrect. Most of the time it's incorrect because they're going through the withdrawal stage. And then the clients get diagnosed again a few days later, and they're done, and then again, another adjustment of diagnosis that sits in place. And this is sometimes when people want to stop their medication, and sometimes appropriate and sometimes not appropriate, but this is where they need to continue, if they're on medication, to continue on their medication, to continue seeing their psychiatrist. Really important to do that. This is where if you notice, a lot of people don't go back to their regular drug of choice. They go to alcohol and drugs. And a family member could say, well, at least they're not doing their meth. At least they're not doing this. I recommend no alcohol or marijuana use at all. Because I really respect the brain process. This is where the relaxation of structure. They don't start meeting their obligations. They don't start waking up at a certain time. They struggle with accepting over their addiction. And they have difficulty with commitment. This is the 6-month syndrome. And then what happened is because they're in denial, it creates a lot of conflict in the family and the relationship. And that creates a justification to go use. It's interesting because when I come in and talk to people in the program, 2 months into it, they give me really a hard time, and they want all this freedom, right? And I know at a biological level, their brain is not ready for a lot of freedom. And so I say no, and then they're like, "You're stopping me from getting better." And I look at them, I'm like, "No, your brain is stopping you from getting better. You know, you really need to slow down. This is not a race, this is a marathon. This is a lifelong condition." You know what I mean? You cannot make up what you've done the last few years in 6 months down the road. It's going to be a long-term process.
So I have a question.
Sure.
At what point in all of this, because I'm on medication for depression, at what point in all this should that condition be reassessed? Should my medication be when should the depression be reassessed, so you tease out the difference between the addiction and the depression?
On a monthly basis, after 6 months.
After 6 months.
On a monthly basis. But I think I usually tell people, tell your psychiatrist, but if you're on medication, to continue taking it. If it's helping you, not damaging you, still take your medication. Because it's really easy at this point to kind of think, well, is it really one or the other? It's still depression, still have it, and still manage it with medication would be important. And I'm not really a big medication kind of person.
Yeah. But if they need medication, how do we segue from here to there? Do we just have to find a new provider, or
Yeah, well,
Pam, or whoever, the medication that you guys have helped them with, but
then we are responsible to linking them to get medication with the provider and everything else. And then continue, and that's another reason we want this meeting is we want our clients to continue this process, and if they're on medication, they need to continue to be on medication. Clients usually, my experience the last 6 months, even the few years back, the last 15 years, is when people stop their medication, within a week they start relapsing, or they don't take their medication appropriately, they start relapsing again. That tends to happen, and the denial sets in. So medication is a really important component to this, especially because the brain is damaged and it takes a while to get better, at least a year or more.
Is it fair to say that somebody may have said, before I used drugs, I didn't have depression, but just part of the process of detoxing, withdrawal, and beginning this new lifestyle, you can expect depression?
Yes.
It's just a normal part of the recovery process.
Depression, anxiety, irritability, mood swings, that's all normal process to others. So that's what I tell families, do not take it personal. You might be mood swing this moment, and then all of a sudden, everything's okay, like nothing really happened. We're like, what's going on with my loved one? Why are they reacting this way? And that's what tends to happen sometimes. But yeah.
So it sounds like the family themselves should also have support then, either therapy or groups or family groups or Al-Anon or Narconon or something.
Yes.
For them to understand and work through their stuff.
Yeah, it's really important to kind of get some support, because sometimes as a parent, am I doing the right thing? Am I being too hard? And that really sets in. Am I really helping too much? Learning that balance of how to assist but not do, it's a big difference. And this is where, during this stage, you go into your drug-using friends, because now you've been clean for a while, a few months. You can go down the street and hang out with your friends. As we start talking, absence of significant other happens sometimes, sexual partners with illicit drugs, groups discussing drug use. It's kind of people that will put you into high risk. So you want to avoid these people, or you want to do less of these things. Any questions? Almost done with this. Some of the stuff you already know this. Places, I'm gonna skip this one. I'm gonna go to, it's really important for you as family members to know your loved one's triggers. What are they? Because everyone's triggers are different. What triggers one person might not trigger another person. Being home alone, I have one person that he gets triggered from 8 in the morning to 10 in the morning. Because that's when he's alone. That's when he drops off the kids, his wife's out to work, and he starts work at 11.
I can relate to that.
So he has 2 hours where it's really hard for him.
Yes, I can relate to that.
Yeah. So everyone has different triggers and different times. So I know one person that his trigger is from 10 o'clock at night to 12 o'clock. He's like, Edgar, this is where I feel my loneliness. Hmm?
See, and I'd give anything to have from 8 a.m. to 10 a.m. to work in the house. I'd just give anything to have that time.
And these are the major emotional states that cause people to want to go use is anxiety, anger, frustration, sexual arousal, fatigue, boredom, adrenaline states, and sexualized deprivation. Because sometimes when we use certain drugs, they're connected to certain behaviors, and the brain makes that connection for us. And that might trigger us to want to go use when we do these things. One last thing I want to finish with is really important. If you leave anything today with any messages, you have to have your structure. You have to follow on the structure. Eliminate avoidable triggers. When I mean avoidable triggers, if you're going to a party where you know you're going to use, that's an avoidable trigger. There's certain things that we could eliminate in our life that are not needed.
I just say that one.
Exactly. And that's such an easy thing to say, very hard to do sometimes because out of our control where things are placed. Important to think about it one day at a time. Do not think about, oh, can I do this forever? Just today. That's all I'm going to do. I'm going to try to stay sober today. Try to reduce your anxiety. Because we know when there's a lot of stress, it creates cravings. And then do things that counters addictive lifestyle. Wake up at a certain time. Eat at a certain time. Sleep at a certain time. Hang out with people that actually are doing something different, the 12-step meeting. So do things that counter the addictive lifestyle. It's really important to do. Provide basic foundation for ongoing recovery. With that is working with a sponsor, working with a mentor. This is where you start being responsible, doing things. The structure is extremely important. People that relapse is because they don't have structure. It's really important to have a structure. Take your medication a certain time, do certain things a certain time, and to follow it. Because if not, it's gonna be really negative. This is what you want your structure to look like, or have some components. I have clients that they finish therapy and they continue to do therapy once a week. They go to 12-step meetings, they play sports, they schedule their time, they work, they go to church, they do recreational activities, they go out camping, they go to school, they have drug-free friends, they exercise. You know, they're doing these different activities that don't revolve with alcohol or drugs. They don't go to, I had one client the other day, and she's like, well, Edgar, if we don't get, what did she say? If we don't get the sports channel, you know I'm going to have to go to the bar and watch the games at the bar. Yeah, that is definitely true. You're managing. And so sometimes the brain's going to make an excuse, but I'm letting you know is creating a structure is extremely important. So when you leave out of here and you go into a program, make sure you have a structure for yourself. What are you going to do? Who are you going to hang out with? What sports you're going to play? Consume yourself at the moment, at least for the first year. And you incorporate calming things during your day. It's not about creating a lot of activities. It's about when you do those activities, something you find rewarding and meaningful also, at least some of them. Okay. Any questions so far? Now, also your personality type is going to affect your schedule. Being perfectionist, wanting things, being demanding, other people's needs, and only partial scheduling is a problem sometimes. If you have problems encountering with scheduling, talk to your loved ones, talk to a therapist, talk to a sponsor, who are you going to talk to if you have difficulty with scheduling. I think the people, and the studies have shown this, that people that remain part of the 12-step program or part in some type of long-term, it really helps them out. Okay. Let me see on the last part. Now, as you go through this, even if you go through the wall, through the honeymoon, you're going to have relapse justifications. This is where your brain tries to convince you, and we call this addictive thinking, that somehow using drugs is okay. It's some reason your brain tells you it's okay to be part of the solution. Because when we get emotional, the brain starts working a certain way, it gets active, that it stops thinking clearly. And we start justifying, what's okay if I drink a little bit of beer, a little bit of weed, I could just take one little hit. For some reason, the brain thinks is a really good thing to do at this part, and that's relapse justification. And so be careful with that. It does come in from time to time, and you've probably had it through this process.
So you're saying even if, like, I drink very seldomly, I'm not a drinker, but I shouldn't drink at all after this. You see what I'm saying?
You want to, okay. See that's what? That's the brain fighting with you saying, I want a little bit of alcohol, right?
Okay.
Now, as a group here, she's asking a really wonderful question. Do I need to stop drinking forever? Good question. What do you guys think?
I think it should be okay if she has a glass of champagne on New Year's Eve, but I'm not a psychologist, I'm not a doctor.
Yeah.
Or if she's not a drug
And I'm
addict.
not a drug, I've never.
I think it depends on the person.
I recommend no at all.
Yeah.
None at all?
None whatsoever, because what happens is when you drink, it activates the reward path of the brain, and you have no control over that. And I know this is the answer people don't like me to give and say it's okay to drink, but when you have a disease, it's like saying someone has diabetes, you could have a little bit of a candy.
Yeah.
You know what I mean? It's yeah, and that's what we have to look at is
More than a little.
more. Yeah, is ever one little candy enough? No.
It's just like you can't have just one potato chip.
Exactly. That's what. And then the reason you have to ask yourself is, why am I drinking this? What is going on with me? And I'm not saying there's some people that they dabble with alcohol and drugs and don't really create a disease or a problem, but there's people that have serious problems because of their addiction. They should not drink at all. If you are in a residential treatment program and you had a secret residential treatment program, no drinking should be the rule of thumb. No drinking whatsoever.
You think ever it like opens up the mind to like your addiction?
Yeah.
Like, as far as like drugs go?
Think about it in your experience. When you drank, what happens?
Yeah, I mean, it became like its own problem, you know?
Exactly.
Yeah.
And so,
Because when you're off meth, you drink.
Whiskey. No more than
So you switch it up.
you switch it up, and I'm glad you say that too. Sometimes we switch one thing for another, and put it this way: I am not scared of the disease of addiction, but I respect it. I respect that it could be activated by me drinking alcohol. It could be activated by doing these things. And what really, the question to ask yourself: what am I losing by not drinking one little champagne? What are you losing?
Nothing.
How you're not losing anything?
Yeah, that won't be difficult for me because I really don't drink.
There's so many functioning alcoholics out there, it's unbelievable. It's just crazy.
And I'm glad you said that, because I look at that situation as when there's an alcohol problem, there is a continuum from mild to moderate to severe. When we start looking at the functional alcoholics, those are the people that have a mild alcohol use disorder, and they sometimes just stay there forever. And then some people, for whatever reason, because of the genetic factors, because of just personality type, take it to a different level. Because there's also mental health problems, they just go to this continuum over here. And some people just stay here all the time. And that's what the individuals you're talking about. And I'm talking about the people that are over here, that they don't come back here. Once they stay here, they stay here forever.
But more things than just alcohol can open up the reward system, the reward pattern in your brain. I mean, it could be some type of food.
Yeah.
I mean, there's other things that can do that. Will that also be wanting to use? I mean, because it's the same pathway.
If your brain is your brain's connected that behavior with using, then yes. Like there's some people that that are, you say for example, let's use meth or alcohol, right? And just being in bars will activate that for them, the desire to want to drink. So think of alcohol activates the desire to want to do something more, something else. Maybe not that one time, maybe not the second, third, fourth time, but eventually it's going to lead to that path. It's a progressive kind of thing. And this is the hard thing. I don't want you to look at this as a lifetime. I want you to look at this as just for today. Because this is like kind of cancer, where when you go to a doctor and you have cancer, the doctor doesn't say you're cured, they say you're in remission. You know what I mean? But if you do certain things, your cancer might come back. And so that's the same kind of thing we're looking at is right now the disease is in remission. When you have an alcohol problem, when you have a drug problem, it's in remission.
But they don't always come hand in hand. Like drugs and alcohol. It's usually, and when people talk about it, they say it hand in hand, usually drugs and alcohol. But it doesn't always come together.
The reason I say this, I'm sorry to interrupt. The reason I say this is because alcohol is a drug. See, all of a sudden I open and talk about no more alcohol, and I was saying, what? No more alcohol? You know, why no more alcohol? Because alcohol is a drug. Alcohol is another drug. Oh, I'm glad you brought that up. Studies have shown that people that stop smoking have a better chance in staying sober from everything. Because the first thing you pick up is a cigarette. And it lets you know something's going on. Studies yeah, so a lot of people, that's one good point, is yes. So if you stop smoking, you have a better chance of actually sustaining long-term recovery. And the studies have kind of shown that. That's why a lot of programs, the first thing they ask you, are you interested in smoking cessation? I mean, because we know that once you stop smoking, you do better. And the first thing you pick up is a cigarette, and you could address that before it gets progressively worse.
Some people don't even smoke only when they drink.
Yeah, exactly. So that's some people. Yeah, exactly. Some people only do certain things when they drink or they use, and they don't do other things. Some people pair alcohol with anger and rage. They only get really angry when they drink. But you know, there's connections that go along with each other, and the hardest concept is to understand that. This is something we put in remission for a very long time, and I'm saying, well, no drinking at all. And I'm not saying that's easy. I'm not saying that it's fair or not fair, but once you really accept that you really have a brain-based disease and we need to put it in remission, is a lot easier to accept. It's not about will. It's not about loving yourself less or loving yourself more. If someone has cancer, you don't tell them, oh, you need to love yourself more so you can get rid of this cancer. In this society, we look at alcoholism. We talk about it lip service, like, okay, it's a disease, a brain-based disease, but we actually don't treat it like a disease. We treat people like they have some form of problem with their will, or there's something wrong with them. And no, we have a brain-based disease. It controls whatever we do, how we think, how we feel, how we act. And that's what we have to look at. It's a remission thing. And if drinking alcohol is bad to activate this brain-based disease that I have, then no. And that's when you have to look at it, is I have this brain-based disease that doesn't function like other brains.
Okay.
Yeah. Any questions, anyone? Margaret?
Kind of.
Yeah.
So, most of the time when people, especially at this level, when you come into a residential treatment center, when you come seeking this type of help, it's because things have gotten pretty out of control. I mean, your life must be pretty out of control to wind up having to come to this level. So I'm kind of not sure what the question is. I'm kind of formulating it, but how is it that you can put in all this work and do this and then forget how bad it was? Like, some people were homeless, they lived on the streets. I mean, I'm doing tricks to get money, to get drugs. It runs the gamut. And none of it was good. And people come in and say, I hated that lifestyle. I never want to do that again. I'm sick and tired of it. But yet they go back there and they can wind up there in a second. So, I mean, where's the disconnect that it skips and that you wind up, and it seems like you said, the relapse, it's very high. So, I mean, is there something that we're missing? Is there to keep that alive so that doesn't happen again?
One of the things that have been mentioned before is keeping the structure and realize, except, for example, and I'll give you a comparison, is we have diabetes, right? We have diabetes, and we know if I have this cookies or something, it's going to affect me very negatively, but we still do it. It's dopamine. The brain wants dopamine, wants serotonin. It makes it feel really good. It gets activated this way. It's a pleasure thing. We want pleasure. We want the brain to survival, and it's a very simple answer to this is what the brain wants. The brain wants dopamine. The brain wants this. So of course, if things are really good, guess what? The brain. I remember what makes me even feel even better, and it's constantly fighting the addictive thinking. That's what happens. It's like we have already sugar, but the body wants more of this. It's craving some of this sugar. If you notice, once I said you can't have this, all of a sudden you want it more. It's also partly psychological. If I can say you can't ever drink this again, like what? You can never eat this food. Well, why not? All of a sudden I want it more. And that's a natural kind of thing that we do sometimes. But at a brain level, is the brain wants dopamine, wants serotonin.
Is there a supplement for dopamine? That's good? You're supposed to supplement that with some kind of nutritional? You're just not supposed to have dopamine at all. No,
dopamine is great. We always have dopamine. It's always been released. But what happens is the meth does it at such high level, alcohol at such high level, drugs do it at such a high level that the brain remembers it. It activates what we call the reward pathway. So I'm glad you brought this question up. Whenever you're having a craving or an urge, think of it as my brain is telling me I want dopamine. So what can I do in a healthy manner to get dopamine? Let me tell you, exercise. Let me have a wonderful conversation with a loved one. Let me be of service, do some community service for someone. Eating certain foods, dancing, listening to music, all those things give you a natural dopamine, but it does never compare to the level that meth gives you.
It helps to like talk to a loved one.
Exactly.
But it's hard to avoid the feeling of it coming up short, you know? Mm-hmm. It's like been my biggest struggle for sure.
Yeah. Mm-hmm. And it's the thing because the brain remembers, it compares how high it was. And by talking, it never compares to the rush of the dopamine you once got. It does it. And so that's why it's really difficult sometimes we forget, because the brain does this naturally and it wants a little bit more of it. And that's what the challenging part of this. As you mentioned, like if you could watch a good movie, but that's nothing compared to that. You know what I mean? And the brain sometimes remembers that. The good thing is, as we stay sober for a longer period of time, the brain starts readjusting itself, healing itself, where the craving for dopamine or for meth, it's decreased. It's not as strong anymore. So after the year mark, 7, 8 months, 9 months, you can start noticing that's getting better. So that's a great thing that I'm letting you know, is that within a year, year and a half, 2 years, your reaction is quite okay, it's quite healthy. You don't have the strong desire as you did before.
And Pam, don't forget, exercise can just be what I do every day. I walk.
Yeah.
I don't spend money at a gym.
Right.
I don't have to go meet some, trainer somewhere.
Right.
I just walk probably 5 days a week. And it's just amazing. It's just, such a good thing. I can clear my brain. And other times, because all my family's back east, other days I call people. I called my brother today. I'm really glad I did. He was great. His girlfriend broke up with him, which I kind of knew. It's just, there's things you can do with walking. You don't have to spend money to do a gym. Just I don't know what the weather's going to be like back where you're.
Yeah,
Is it Michigan?
No, it's Ohio. It gets pretty humid, but I can walk in the evening, and I have 2 very dogs that will help me walk down the street. They will make me walk very quickly.
And just to kind of end things, I'm glad you brought today, it's having a balanced lifestyle in your recovery. Getting sleep is really important. The brain starts healing itself when we sleep. Sleep your 8 hours. 10 hours, sleep. That's really important. Do not oversleep because you get more tired. And if you use meth and you oversleep, you feel tired, then you're going to want to do something to give you a kick up. Now, leisure is really important. Relationships, recovery activities, work. Try to balance all these things in your life. I'm not going to say how much to do of what, but these are important components to have a balanced lifestyle. This is a long time or long life issue that we're going to have to manage and deal with. So just coming to treatment for 60 days, for doing for 3 months, this is just the start point. This is lifelong. This is very lifelong. Any questions?
So to be clear, I have a primary physician at home. That can continue the medications. There's even a therapist there that can continue the medications. I know that we've talked about doing sessions with you, which I'm more comfortable with. I know in my area, we have one addiction specialist, one for the whole area. So I can't imagine even trying to get into him, and I don't know him. So is that sufficient other than going to meetings? And I have an idea of where I'm going to go when I get home.
Put it this way, it's important to continue this treatment process for a year and a half, whether it be to 12 steps, whether it be the individual therapist. It's important to do this for a year and a half. And I say this because it's easily to fall back into old behavior if no one's holding you accountable. The brain is going to go back to old behaviors. So it's really important to continue treatment, whether it be, and the good question is it sufficient? You're going to have to assess that for yourself when you're going through that process. I have a client now, I think he's on the 8th month. He's finished programs, he's in the 8th month with me, and he's doing pretty good. You know, he's pretty good, and now we're going to start talking about, I'm going to see you now, I'll see him every week. We can now start for me to see you maybe twice a week to maybe once a month now, because he's doing so well. Things are going really well. He's already through all this. He has a good balanced lifestyle. His family's already back in his life. He has a sponsor working the steps. He's doing really good. He doesn't really need that much therapy. And so to answer your question, it could be enough or it might not be enough. You know, if you're adding the medication support, if you're adding the therapy,
Yes.
even if your husband's part of your life like he is, doing therapy, that might be just all you need.
Religious
Yeah.
people, priests, ministers,
Yeah, exactly.
somebody that you trust, mentors from the past, maybe that you trust and back it up.
Exactly. Religion, I'm glad you brought that up. Religion is extremely important. Spirituality support, extremely important in this. Really good. I've had clients that actually do less therapy and do more religious support, and they do excellent. Right now, the research is out there that says, is therapy better than this? No, it helps. Whatever you do that is healthy is going to help you, and that's what you want to do more of. And those are lifestyles that fight against addiction, which is great. Yeah. Okay. And I guess the big message is continue therapy somewhere else, continue services, continue 12-step meetings, continue to encourage your loved ones to continue treatment. Somehow, maybe not as intense, but continue. Because their brain's going to want to use this drug within 160 days, 180 days from now. It's going to want it. It's going to be there. Doesn't mean you want it, but it's going to happen. So this is the message I'm trying to give to family members. Encourage your loved ones to continue services, even if they don't want to. It's important for them.
Okay.